Hi everyone, and welcome to our third video of this Navigating Early Childhood series. My name is Lydia. In case this is the first video that you're watching, I am a doctoral occupational therapy student at the Robbins College of Health and Human Sciences at Baylor University, and today we're going to be covering early childhood health and development of children with Down syndrome. This might be a little bit lengthy. I'm going to do my best to keep it pretty short, but we have a lot of information to cover. However, we're not going to be going super in-depth. This is more just an introductory, what you can expect for the first 5 years of your child's life as far as healthcare and their development goes. So let's just jump right in. So before we start talking about health and development, I do want to take a moment and just clarify a few things, and I want to emphasize that children with Down syndrome are extremely capable individuals. I'm sure you've already seen that with your kiddo. I've seen that in my sister who has Down syndrome. They are not to be underestimated, and the topics that we're going to talk about, we might talk about how their development might be a little different from other children, and I just want to clarify that that is not to say anything about their capabilities. We're just pointing out some of the differences that have been observed in this population. The information that's included in this presentation is evidence-based. It's from reliable sources. And again, it's just an observation of what we've seen within the population. It's not meant to tell you what your experience will be. Children with Down syndrome vary in their development just as all children do. I'm sure some of you parents out there with multiple children have seen that one child started crawling at this time and the other child started crawling at this time, and everyone's completely different, and that still applies to children with Down syndrome. And then finally, if you have any concerns about your child's health and development, please consult your doctor, therapist, whoever is on your care team about any concerns you might have. So we're first going to start off by talking about just some of the physical characteristics that we tend to see in individuals with Down syndrome, and some of these do seem pretty obvious, but I did want to include them just because some of them are a little bit more obscure, and just for maybe the new parent out there that doesn't know about all of these, I just wanted to clarify that these are really common and that they don't affect the child's health or development in any way. So something that we typically see in this population is a smaller head size, as well as something called epicanthal folds, which is what this picture is showing here of this kiddo zoomed in on their eyes, and it just refers to the way that the eyelids have folds in them. And then they tend to also have a flatter nose, an almond eye shape, and something called brush field spots are pretty common too, which are just little bitty like specks on the eye that are totally harmless and they don't affect vision at all. They also tend to have a small mouth and ears, and they might have excess skin at the nape of their neck. They also tend to only have one crease in their palm that crosses the whole palm, which most people have two. They might also have a shorter pinky finger, and it's often curved, and then they also might have a larger space between their first and second toe. So now we're going to jump into early childhood health, and we're going to talk about what your doctor might discuss or look at with your child in these first few years, and also we're going to take a look at what medical conditions are common within people with Down syndrome. So I did want to include this. I know it's pretty small, but in case you wanted to take a screenshot or anything, this is a chart containing the most common medical conditions that are seen in people with Down syndrome, and it also has the percentage of people with Down syndrome that also have these different conditions. This is from the American Academy of Pediatrics, and it is the most updated version that they have, which unfortunately is from 2011. So I don't know how often they update these things, but in my opinion, this needs a bit of an update. But it is the latest one from them, and we're going to talk about several of these on the next few slides. So for a few of these slides, we're going to kind of take it by organ or system or part of the body. But starting off with the heart, it's not uncommon for children with Down syndrome to be born with various heart conditions. Often these are caught at birth or shortly after birth, and they're often related to the development of the walls of the heart chambers. These conditions might heal on their own, or they might require surgery. It just really depends. It's important to note that a lot of children have had these heart surgeries when they're little, and they have great recovery rates, and these are just surgeries that help them to live longer and fuller lives. So talking about the ears, nose, and throat, approximately 50 to 75% of individuals with Down syndrome have hearing loss at some level. They also have smaller eustachian tubes, which are the tubes that connect our middle ear to the back of our throat, and these being smaller makes them more prone to ear infections. This is especially as they're really young. Like with other children, this risk will decrease with age and get better. Also, due to variations in their anatomy, again, mainly having smaller nasal and sinus passages, they are also prone to upper respiratory infections. That includes things like sinus infections and just like getting colds. And then they're also at risk of developing obstructive sleep apnea. About 50 to 79% of individuals have sleep apnea, and we'll talk about that a little more later, but it is recommended by 4 years old that children with Down syndrome get a sleep study now. Moving on to the eyes and vision, it is very common for children with Down syndrome to have issues with their vision. A lot of them wear glasses, and it is recommended that they get their vision checked as early as 6 months old, which seems so little. And then, of course, yearly after that, as is recommended for everyone. They also might be born with cataracts, which is an opaqueness that is on the lens of the eye that affects their vision. If these are mild, it could go untreated, but if they are more severe, it could require surgery to remove them. And then also another issue that we might see with this population is something called strabismus, and it's basically where the eyes do not move together all the time like they should. So again, glasses can help correct that, or they might need to do some eye patching for a period of time to help correct that. The musculoskeletal system includes muscles, bones, tendons, ligaments, all those structures that help keep our body intact and that help us move like we should. Now, individuals with Down syndrome might have issues related to these structures because of something called ligament laxity. This basically means that when they're born with a particular looseness in their ligaments, which are the structures that connect bone to bone. Unfortunately, this results in a greater likelihood that they might have hip and knee problems later, and it could also cause things like foot pain. They're also at a greater risk of atlantoaxial instability, which basically just means that there's too much movement between the bones of the neck, and that can be potentially dangerous. Individuals with Down syndrome are also born with low muscle tone. This means that their muscles kind of appear relaxed and floppy. Now, this can be definitely worked upon, especially through therapies like physical therapy and occupational therapy, and it just might take them a little bit longer to develop movement and the strength that they need. It also results in them being extra flexible. Let's talk about the digestive system. We just talked about low muscle tone on the previous slide, and believe it or not, that actually plays a role in digestion too. Because of that low muscle tone, often in these individuals, stool moves through the digestive system a lot slower, and because of that, extra water gets reabsorbed, and this can actually result in constipation. Children with Down syndrome are also more likely to have celiac disease, which is an intolerance for gluten, and they might also be born with anatomical variations that can cause some issues as well. So this isn't going to affect that many people with Down syndrome, but I did want to mention it because children with Down syndrome do have an increased risk of seizures, and data has shown that 1 to 13% of individuals with Down syndrome get diagnosed with epilepsy, which is a seizure disorder, which if you're not too sure what a seizure is, it's basically just where the brain experiences a surge of electrical activity and it takes over the body for a short time. And so it's just something to have on your radar, especially as they're babies. These seizures are more likely to happen, but again, it's not going to affect a huge part of the population. Now, disorders of the blood also affect a pretty small percentage of those with Down syndrome, but it's still important to at least be aware of because children with Down syndrome are at a greater risk of developing these than children without Down syndrome, and they usually appear between 0 and 5 years old. This includes conditions like anemia, iron deficiency, leukemia, and transient leukemia, and you can see the percentages of the population that had those as of 2011 on this slide. Again, this is pretty rare, and we're going to talk about in a little bit that doctors might do blood tests throughout your child's life, so it's just something to be aware of. Individuals with Down syndrome are also more likely to experience issues with their thyroid gland. This is responsible for producing hormones that help regulate our bodies. Most commonly, they deal with hypothyroidism, which is low thyroid hormone production, and this can occur at any age. The symptoms of this can also be kind of subtle and hard to catch. It includes things like weight gain, constipation, decreased muscle tone. So especially for individuals with Down syndrome, you're going to want to be aware that this is something they can experience. They're also more likely to experience hyperthyroidism, although not as many do as hypothyroidism, but hyperthyroidism is high thyroid hormone production, and it still occurs a little bit more frequently in this population than the general population. But the symptoms of this do tend to be more noticeable, and the thyroid is something that should be checked yearly, which we'll talk about here in a little bit. There are also some differences that can be observed in the hair and skin that we don't really have a lot of clear reasons for, but they do tend to have hair that is thinner, softer, and more sparse, and they are more prone to hair loss. And then also they tend to have skin that is drier and is prone to irritation. So now that we've talked through some of the more common medical conditions affecting those with Down syndrome, we're going to kind of break it down by age and talk about what your doctor might look at during each phase of early childhood and what things you should be aware of. For birth to 1 month, remember that they are going to be more prone to upper respiratory infections, so things like common colds and sinus infections. Of course, we don't really think too much of that as adults, but as babies, you want to make sure that you're being as proactive as possible and keeping them healthy, so just remember that they are prone to that. Your doctor might look at and discuss their heart, monitoring the conditions that maybe they already have diagnosed or looking to make sure that nothing was missed. Feeding, they might ask you how your baby's doing with that, and they might get a swallow study done if feeding seems to be an issue for your child. They're also going to look at their eyes, make sure that they don't have cataracts, and their ears as well. Testing for hearing loss kind of begins right away, and so they'll be looking at that. Also the digestive system, making sure that they're not having any concerning symptoms like constipation or reflux. They're also going to pay attention to their breathing, just make sure that everything is working as it should. And then, like we talked about, they also might do some blood work to screen for abnormalities in the blood and thyroid function. At this point, if you haven't had a referral to early intervention services, your doctor might initiate that as well. So from 1 month to 1 year, you'll see that a lot of these are similar to what we were already looking at. And then even as they get older, a lot of these will continue to be assessed as they grow. But during this time, your doctor is going to, of course, discuss your baby's overall growth and development, just making sure that they are a happy and healthy baby. They're also probably going to look at their ears. Remember that these babies are at a greater risk of ear infections, and they're probably going to test some more for hearing loss. They're also going to look at their vision, and they might refer you to an ophthalmologist specifically to get that done. They're also going to continue to monitor their thyroid function for heart defects. They might do some hemoglobin testing to determine if they're iron deficient. They might ask you about seizures, if they've had any of that, and take a look at that. And then they're going to make sure that your baby's up to date on immunizations, and they might discuss with you the symptoms of sleep apnea. As we discussed in one of our previous slides, this is something that parents should be aware of, especially as they're getting closer to that 4-year-old age. From 1 to 5 years, so much is happening for your child. They're starting early intervention, transitioning out of early intervention, starting school, maybe selecting sports to get into. So much is happening. So of course, they're going to be looking at your child's overall growth and development. They're going to keep looking at their eyes and ears, just monitoring vision, hearing loss. Of course, heart monitoring if they have diagnosed conditions. They're going to check the thyroid yearly. They're going to discuss any digestive issues that your child has. Of course, they're going to continue to do blood work. And when they reach the age of 4, they are likely going to recommend the sleep study, as we discussed. They also might talk to you about that atlantoaxial instability that we talked about, because when there is more movement between those vertebrae in the neck, it does put them at greater risk of dislocation and thus spinal cord injury, which is a really serious injury. And so they might talk to you about maybe discouraging involvement in some really contact-heavy sports, or using trampolines, or just things and activities that could really put them at risk. They also might discuss with you, or you might notice that your child has abnormal teeth coming in, or they're coming in at weird times or in weird patterns. All that is completely normal, and it just happens in children with Down syndrome. There's not much explanation from what I've seen. And another interesting fact is that children with Down syndrome rarely have cavities. So that's obviously a plus. And then, of course, they're going to want to talk to you about diet and healthy habits and how your child is doing in therapy. So now that we've talked a lot about health conditions and what things children with Down syndrome are at risk for and what you might discuss with your doctor, we're going to switch gears a little bit and talk more about development, which is still obviously a facet of health, but we're going to talk less about medical conditions and more about what it will be like for your child in the first few years of their life as they are learning and growing. So overall, children with Down syndrome develop much like other children. They just might be a little bit slower to reach some milestones. We've learned a lot about Down syndrome and the needs of those with Down syndrome in recent years, and a lot of progress has really been made. There's more inclusion, education, access to healthcare, and early intervention services, and those have helped individuals with Down syndrome excel even more in all the different areas of development. For the purposes of this presentation, we are going to categorize development into 5 different categories, and those are communication, social and emotional development, motor development, cognitive development, and self-help, and we'll kind of define and go into each of those separately. Communication includes a lot more than just talking. It includes facial expressions and gestures, which are nonverbal communication, and also the ability to listen to others and to understand them. Children with Down syndrome often understand more than they're able to say, and overall communication is considered a strength of individuals with Down syndrome most of the time, even if they have trouble speaking. They're usually good at making eye contact and taking turns in conversation and just getting their message across. They might have significant difficulty with developing clear speech that's easily understood by others. This can be due to hearing loss or issues with controlling the muscles of the mouth and the tongue, or other reasons. A lot of children will begin speaking between 2 and 3 years of age, but I also want to point out that some people use assistive devices to speak or use sign language. It really just depends. Usually, though, by the teenage years, most children with Down syndrome have a pretty good vocabulary. It may help to make learning related to speech as visual as possible. This is something that has seemed to work for people in this population, like using sign language along with saying the words, or by using pictures, like printing out a visual schedule. Next, we have social and emotional development. This includes understanding others and getting along with them, behaving in ways that are socially acceptable, and understanding and managing one's own feelings and behaviors, also known as self-regulation. Now, this area of development will largely depend on your child's personality, just as it does with any other child. Early on, though, in general, children with Down syndrome tend to be very interested in people and very social, maybe even to the point of not being as interested in toys and other things like that. They have a really good understanding of how others behave socially, but they might require guidance on how to use this strength in ways that are helpful. For example, young children might act a certain way just to get a reaction out of people, maybe in a way that's unhelpful. So a way to help with this would be to encourage interaction with other children their age, particularly children that you think could model appropriate behaviors to them. And then also, it's important to encourage age-appropriate behavior as much as possible. This is also a good reminder for other family members, maybe grandparents or siblings who tend to kind of baby the child. You want to encourage age-appropriateness as much as possible, and again, having other children around them can definitely help with that as well. Now we're going to talk about motor development. This refers to the child's ability to move their bodies in different ways, whether that's in big ways like walking or jumping, which we often call gross motor skills, or in smaller, more precise ways like holding a crayon or using scissors, which we would often call a fine motor skill. Children with Down syndrome achieve many of the same motor milestones as other children. It just might take them a little more time to develop the strength and the control that's needed for certain skills. And it's important to note that not everyone shares the same patterns in motor delay. That's why I didn't include any charts here on when you could expect your child to do different things, because it really is just going to depend on your child. If you're interested in that kind of information, I will have one chart at the end and some links in the resources page to charts like that will show you what you can expect when. But it really depends for each child, and I didn't want to put that in here if it wasn't going to be helpful for everyone. I know some people don't like looking at that kind of information, so it's really just going to depend on your child. I also want to point out that many children with Down syndrome play sports and participate in physical activities, and it's really important to encourage those activities and to give them opportunities to participate. Also, seeking the advice of physical therapists and occupational therapists can really help children make great progress in this area of development. And then finally, practice, practice, practice. Give children just the freedom to move and to play, to explore their environment, to exercise, and children learn to move through moving, so that's really going to be your best bet here. Let's talk about cognitive development, which just refers to our ability to process information, to think, to remember, to reason, and to problem solve. I want to emphasize again that children with Down syndrome are often really good visual learners, and we want to use this to enhance their learning in any way we can. Evidence has shown us that they have better visual short-term memory than verbal short-term memory, meaning they're going to remember something that you show them a lot better than something that you just tell them. Even though individuals with Down syndrome often score with mild to moderate cognitive impairment when taking standardized tests, I want to emphasize that they are capable of gaining problem-solving skills just like other children. They just might require some extra guidance. For example, they tend to not persist with problem solving as long as other children would. They might want to give up, and you might have to give them that extra push of encouragement. They also might need more supported play. A lot of times children can get frustrated when they don't know what to do next or what to do with the object that they have, and this could lead to repetitive play, like just lining up the toys or throwing them, and you might have to show them what the next step of play is. This is often referred to as scaffolding, which is basically just providing enough support so that the child can be successful, they can see how it's done, and then you can slowly back down on the amount of support that you're giving them as you see that they're starting to master playing with the toy and they're becoming more independent. Now, I do want to point out something that is a common myth, or at least it used to be. A lot of people used to think that learning would plateau in middle childhood for these individuals, and I just want to state clearly that that's not true, that people with Down syndrome can continue to learn all throughout their life into adulthood, especially when they're in inclusive environments. SelfHelp Skills refers to the skills that are necessary for promoting independence in everyday activities. For our younger kiddos, this is going to be skills associated with things like eating, toileting, hygiene, dressing, and as they get older, the skills needed for things like cooking and managing their money and home. Now, bringing it back to that early childhood phase, toilet training might be delayed, and it's likely going to happen sometime around 4 years old. I also want to emphasize that children do not have to be verbal to be successful with this. I've seen this firsthand. My own sister who has Down syndrome was nonverbal when she was potty trained, and I believe it was just before her 4th birthday. So if that's something that you're concerned about, I'm here to tell you it's totally possible. They do not have to be verbal. I also want to mention that self-help skills might rely heavily on the progress of motor skills, so it can get a little tricky. If they're maybe delayed more in their motor skills, it's definitely going to affect their self-help skills, especially fine motor skills, those little small precise movements. But progress is heavily influenced by practice. Give them lots of opportunities for independence. If their siblings have chores, give them chores, even if it's the little things or even if they're going to need a lot of help with it. I think, in my opinion, it's better to have high expectations because they're often capable of a lot more than you would expect. So again, just try to make their routine as similar to their siblings as possible, and I think that that will give them plenty of opportunity for independence. So up to this point, we haven't talked a lot about specific ages for different milestones, and that's kind of been on purpose. I know we talked about it for a few things, but for the most part, I didn't want to just include like, oh, you can expect this by this time, you can expect this by this time, just because I know that can be kind of discouraging for some parents, especially if their child maybe isn't doing some things that they thought they would be doing or anything like that. And that's just not the goal. I just didn't want anyone to be discouraged by that. And I really want to emphasize that just every child is uniquely different and on their own timeline, and that's totally okay. The only thing that matters is you supporting them and you being a loving parent to them. But I also do at the same time want to provide some sort of guidance for maybe the parent out there that has a newborn right now or just really has no idea what to expect. So I'm going to do kind of a quick run through like the first 5 years and by age 5 what you can expect. So I have a few of them listed here. They're probably learning social skills and learning to behave in socially appropriate ways. They're also likely toilet trained or working on it. They might be able to feed themselves with a fork and spoon, drink from an open cup. They're probably able to remove clothing, and they might be able to help you start to put it on. They're likely able to climb stairs, to begin to run, to catch large balls. They're probably starting to draw and write, and they might be talking with either single words, short sentences, or using sign language. They also might know their colors, and they're probably beginning to count. And just like other children, they probably enjoy reading and children's shows and all the other things that children love. I also want to note that there are lots of factors that influence progress with these. It can go down to genetics, to your home environment, to hearing and vision difficulties. Maybe they have an autism diagnosis along with Down syndrome. It just really depends, and no one's child is going to look the same as far as development in all the realms is concerned. And once again, I just want to emphasize that the intention is not to discourage or to make you feel like you're on a certain timeline or that your child has to achieve something by this birthday. That's really not the intention. It's just to give you a good idea of what your child could do. Also related to that, I wanted to include this chart because I think it's a really great one. If you're looking for this information, this is from the National Down Syndrome Society, and it's a milestone chart that just has some of the more major milestones and then when you can expect a child with Down syndrome to reach them versus a typically developing child. And I will also have the National Down Syndrome Society linked on the resources page, as well as the link to this chart and some other information related to milestones. As we begin to wrap up, I just wanted to include this slide on supporting your child because I think it is the most important thing you could do for your child alongside just loving them and making them a valued member of your family. And I wanted to encourage you to just keep extra time spent doing therapy things or teaching your child. Just keep it in perspective. A lot of that can be super helpful and super awesome for their progress. But at the same time, the goal is not for you to feel guilty for not doing enough or to give you a bunch of homework as a parent. Keep it to a reasonable time. And the most important thing is if it's working for your family and if it's benefiting your child. At the same time, incorporate any of those therapy or teaching strategies into the child's existing routine. That's just a great way to keep it to a reasonable and manageable amount, and it just makes for a smoother transition of those concepts that are taught into their life. Also, do not undervalue the learning opportunities that you give your child by just taking them out in the world and living normal family life. Every time they interact with people or they're around other children, they're learning, and that's great, and don't underestimate that. I also want to encourage you to provide opportunities for your child to be around children without Down syndrome as much as you can. This benefits everyone involved, really. Of course, your child is probably able to learn from other children who are modeling behaviors, but also studies have shown that people that are around people with special needs are just more empathetic people, and children need to see that. Children need to be around other children that maybe aren't exactly the way that they are, and that's how we make progress with inclusion and with people being accepting of people with disabilities. And then also, if you're looking for specific activities to do with your child, of course, reading or sorting and matching tasks can be really good. Puzzles, things like that. Look for things that can be fun yet beneficial for your child. And I want to emphasize again, probably the best way to go about this is errorless learning. Just let them be successful. Do provide the support that you need to provide for them to be successful. And then as you see that they're getting it on their own, you can kind of back down a little bit. Okay, so here I've just added a few of the resources that I think could be helpful to you. The National Down Syndrome Society, as I mentioned, has that milestone chart, and they have lots of great information on their website. I've also included the American Academy of Pediatrics. They have this document for families of children with Down syndrome that I think is really helpful. It explains a lot of what we talked about as far as healthcare goes, and it's just like in a nice, neat format. And then I also included a few evidence-based studies on development. These are studies done by researchers that go over gross motor development and cognitive and communication milestones, and they just take real groups of people with Down syndrome and study them. So I put those in. I really enjoyed reading those studies. If you're into reading studies, if you're not, that's totally cool, but I wanted to include them if you're interested. And then also the Down Syndrome Association of Houston, of course, if you need to get in contact with other parents. Maybe you're looking for parents to find a good therapist or to talk to them about who they see for their pediatrician or just different things like that. The Down Syndrome Association of Houston is a great way to meet other parents, and also we can help get y'all connected to any resources you need. So do not hesitate to email us as well. Here are the references that I used for this presentation, and I wanted to make a quick note that you can also email me personally at lrodriguez@dsah.org should you have any questions that are directly related to this presentation. Thank you guys so much for watching, and I hope that something in here was helpful, and I look forward to the next few weeks making videos for you guys.